Welcome to the Plant Trainers Podcast, where we're helping people improve their quality of life through nutrition and fitness. And now, your hosts, nutrition and wellness coaches, international speakers, Adam and Shoshana Chaim.
Hey, I'm Adam Chaim.
And I'm Shoshana Chaim, and we are
Propelled by Plants. Today we bring to you episode 431, a plant-based diet for heart rehab patients with Colleen Montgomery.
In this episode of the Plant Trainers Podcast, we talk with Colleen Montgomery about a plant-based diet for cardiac or heart rehab patients. Colleen breaks down some of the cardiology information for us, like what is cardiac rehab, who should be getting it, and what lifestyle changes can be made to improve your cardiac health. We also discuss statins and why you would not want to be on them, why you'd want to try to avoid them, and how to cautiously start exercising. We also discuss children and teens and why to start making smart decisions for their health right now.
Colleen Montgomery is a clinical exercise physiologist, certified plant-based health coach, and owner of Wellness Within LLC. During her 12 years working with heart patients, she discovered the powerful medicinal effects of food and other lifestyle choices. Now her clients improve their heart health in big ways by combining the most effective behavior change techniques with the healthiest habits on the planet. Impactful episode right here for young, old heart patients and not. This could change your life just by listening to this show. So enjoy the show and share it out. Finding the right toque to keep your head warm with comfort and spreading the plant-based message isn't such a simple task. That's why we decided to put together a fantastic toque made from 100% organic cotton that does the job. Grab one of our PlantPowered Toques and enjoy comfort while supporting and spreading the message of eating more plants. Check it out at planttrainers.com/shop to get yours now. And now for a moment of gratitude.
I'm just grateful for the amazing people that I meet every day. I'm meeting people who are doing well with their health, people who want to do better for their health, and other health practitioners who just want to learn everything that there is out there. And I'm loving these conversations that I'm having with people.
The weather has been getting quite cold around here, and I'm just grateful to have warm clothes to wear. It's simple as that.
Colleen Montgomery, thank you so much for joining us on the Plant Trainers Podcast today.
Thank you so much, Shoshana and Adam. I'm so happy to be here.
We're happy you're here too, and we want to know what else you're happy and grateful for in this world right now.
Today, I am especially grateful for my and my husband's family. We're expecting a baby soon, and they have just been an enormous help, just painting, getting the house ready, and just so willing to help. So I don't know how we would have done it without them. So just feeling especially grateful for them today.
It's really an exciting time. It's exciting and you get a little bit nervous bringing home that second one, but it kind of rounds things out and you kind of say, oh, why did I overthink so much with the first one when the second one comes in? So it'll all be good.
Do you really do that though?
What?
Overthink the second one because you had the first?
No, you
underthink the second one.
No, what I meant was with the second one, you wonder why you overthought everything with the first one. Is that not what I said?
Yeah, but I think you would treat them both the same, wouldn't you?
No, because it's like, okay, they did, like, you don't have to look, okay, so this one didn't poop for 12 hours. Well, it's okay.
So you worry
until
less.
You worry less.
You're not going to call
think
the
about
doctor.
less things, or you're not super strict about schedule with the second one because you're schlepping around the first one everywhere.
So because you've been through the experience with the first one, you now have that to rely on for the second one. So you're less concerned about the little things.
Yeah, and it's a lot. It's very similar to plant-based, where at first you're like, oh my God, what do I eat? What do I do? What do I this? What do I that? What do that? And then you have like a friend who's going plant-based and you're like, oh, it's no problem. It's super easy. But it's like you forget and your subconscious suppresses all of those worries and fears about what to do and what to eat and what to say. Mm-hmm. You forget what you went through. Mm-hmm. And you kind of expect everybody else who's going through the transition to do the same. And so with the second one, it's kind of like, no problem. So they sleep in their bucket instead of their bed. Well, at least I get my first kid out of the house kind of thing, right? Like it's super different. Yeah. Anyway, all of that, but this is a plant-based pregnancy. This is super fun.
Yes. Yeah, it is. And the first one was, but my transition has always been a very slow, gradual one, which I encourage anyone to take that approach if that works for them. So yes, this baby's getting a lot of plants, and he or she feels very happy about it. So
awesome. I bet they do. So tell us about how you found plant-based and what changed for you.
So I found it a number of years ago. Kind of a couple things happened all at once. I reconnected with a fellow health coach who was really into plant-based eating. She sort of introduced me to it. And then around the same time, I stumbled upon nutritionfacts.org. Are you a fan of that site?
Of course.
We just ordered sweatpants and a mug from there yesterday. So I'd say yes.
Yeah, that's a yes. So if you're like me, I was instantly hooked on this site. So for anyone who's not familiar with it, it's Dr. Michael Greger and his team who just scour all of the nutrition related scientific studies, and they create bite-sized videos that show just the incredible benefits of a plant-based diet. And I just could not get enough of these videos. And I eventually went on to get a couple certifications in plant-based nutrition. And all the while, I sort of kind of remembered just a quick mention of Dr. Esselstyn, who I'll probably mention later, who's a big name in heart health and plant-based eating. I think his name was mentioned in grad school when I was learning, extensively about heart disease. So I don't know why that was skimmed over so quickly, but that's kind of how I came to discover it. So as I gradually taught myself and then eventually got certifications, I started to adopt the lifestyle gradually as well. And, I was kind of in good health to begin with, so I didn't notice any major changes, but certainly I feel a lot better when I'm eating less processed foods. And I do believe that I saw a reduction in my overall anxiety levels, so that was a huge plus. And I would say probably the biggest change for me was what happened around me. I was by no means pushing this way of eating on anyone, but I started to notice that my parents were eating less meat, and some of my friends were asking me questions about meatless recipes. And since then, I've worked with a number of family members and friends, either officially or unofficially, to help them eat a healthier way. And my latest client actually was someone who I know very well, who dramatically improved her health. She dropped her cholesterol 100 points in a matter of weeks. She lost 35 pounds. She normalized her blood sugars and a slew of other benefits. Her energy increased dramatically. And that was probably the biggest change for me, was what was happening around me and all of those really positive changes and the open-mindedness that I wasn't really expecting among my family and friends.
So I'll say that nutritionfacts.org is the encyclopedia of today. Mm-hmm. And
Absolutely.
We'll put a link in our show notes to our episodes with Dr. Michael Greger. And then I'll also say it's super impressive that in grad school, they mentioned Dr. Esselstyn, because that's not something that a lot of people experienced in their schooling. And he was definitely an influence for me as I overcame my beginning stages of heart disease. And I read Prevent and Reverse Heart Disease by Dr. Caldwell Esselstyn. And we had him on our show as well. So we'll put a link to that in our show notes. And now I interrupted you. So you wanted to say something.
I did want to say something, and I need to remember what it was. I mean, yes, part of it was that we were going to link to that at the show notes at planttrainers.com. And I think the other part is that you were not in a situation where your life was at stake. You were not in a situation where you were like, maybe if I go plant-based, maybe my anxiety will decrease. You saw the research, you saw the science, you saw what was happening to other people around you, or not around you, but the anecdotal of other people and the science together. And you said, well, why not me? You weren't waiting to be in that situation where it was like, oh, I need to have my first heart attack to get there. I need to, be pre-diabetic to get there. So I really applaud you for that. And despite not necessarily thinking your health can improve, it did. And obviously it did enough for other people to recognize that. It wasn't necessarily just that you were eating plants. People must have realized something about you. Maybe your skin, maybe your eyes were a little bit brighter. Maybe your hair grew a little bit faster and shinier. Everybody wants better hair. So So yeah, so I think that that's wonderful. And I think that's a really important lesson. Adam's like, what can I eat to stop my hair from growing?
If only. Yeah. And,
Exactly.
and actually, like along those lines, I wanted to start practicing what I was preaching. I didn't even mention my heart patients. I've been working with people with heart disease for, 12 plus years. So I started to change my dialogue with them. And I wanted to say, hey, it's doable and this is what you can do, instead of just talking about the benefits. They want to know the how. So you can't really learn the how unless you do it yourself.
Exactly. So let's talk a little bit about your heart patients. You work in heart rehab. Can you kind of explain that to people who might not know what that is?
Sure. I'm so happy you're asking this because there are only a small fraction of people with heart disease that take advantage of cardiac rehab or heart rehab. And part of that is because there aren't cardiac rehab programs all over the place. But sometimes people simply just don't even know it exists. So we're saying heart rehab, but more formally, it's known as cardiac rehab or cardiac rehabilitation. And it's basically like physical therapy for people with heart problems. It's an insurance-based program. And it's the patients that go there have diagnosed heart disease of some kind. So they either have recently experienced a heart attack or open heart surgery, whether that's a bypass surgery or a valve replacement. Some of them have heart failure or something more, significant like a heart failure, or had an LVAD placed, which is a left ventricular assist device, which essentially pumps for your heart if your heart is extremely weak. And then occasionally you'll see a patient that has had a heart transplant. But most of the people in cardiac rehab either just had a heart attack or they had a more common heart procedure, which is called an angioplasty or stent, where they go in and put a catheter into the blood vessels that feed your heart muscle with blood flow and oxygen. And they open up a blockage with a balloon, and then they place a stent in there, which is kind of like scaffolding to keep that blood vessel open so that the blood flow, returns to 100% like it should be. So that's a heart patient, but everything we'll talk about today applies to those patients as well as anyone that has any risk factors for heart disease, which unfortunately there are millions and millions of people out there with one and usually multiple cardiac risk factors. So everything we'll talk about will benefit them as well.
So let's talk about some of those risk factors. I assume that they would be lifestyle, right? And I think a lot of people think they're genetics. They confuse genetics and lifestyle, right? Everybody in my family has heart disease, has high cholesterol, has high blood pressure, but sometimes that's genetic from a cellular level, and sometimes that's lifestyle because of the way you grew up eating, the way you continue eating, lack of exercise, high cholesterol foods, right?
Yes.
Mm-hmm. And so what else can you add in there? So
yeah, the risk factors for heart disease, you've pretty much named most of them. And then it also includes high blood sugars, physical inactivity, and genetics is, I love this topic because yes, our family history does play a role in our future health, but the science is actually pretty clear that we actually have some amount of control over our genes. And that is by way of food in one way. What we eat can actually affect the way our genes act. So they can turn some on, turn some off. So what we eat can control these so-called non-modifiable risk factors, things that we think we don't have any control over. And then of course, food plays a huge role in, blood pressure, cholesterol, blood sugars, our weight, and, very, very substantially as well. So food can actually greatly improve those risk factors and even eliminate some of them. I think there's a big myth around it, right? Is that my family had it, I'm destined to have it, doesn't matter what I change. What other myths are there around heart conditions? I would say that is number one, and that's across almost everyone. That's why I love podcasts like this and other resources that get the word out there that you have so much control over your health. So, for example, there are plenty of studies that show that up to 90% of heart attacks can be prevented. And it's all through the daily choices that you make. That's the kind of message that we need to spread, is that you have that control. And plant-based eating is, food is really the number one determinant of our health. That's without a doubt. And, what you eat can make or break your heart health. And you can there's a lot of studies that really show that you can eliminate high blood pressure, you can eliminate high cholesterol just by changing your diet.
How early in life do these risk factors show up or the symptoms present themselves? And how early in life should we be modifying our lifestyle to be able to overcome this?
Winter's coming. In fact, it feels like winter is already here. And what we have for you is a way to cover your head, cover your ears, keep you warm, and let people know that you are powered by plants. We have our plant-powered toques out and ready to go. It is not too late to order them for Christmas gifts for yourself or for someone that you love. So visit planttrainers.com/shop and get yourself a toque now. And we will put in a little card for you thanking you for your purchase. But if you want that to be a card that's a gift for somebody else, let us know and we will do that for you.
Great question. Right away.
However, from the womb.
Yes, from the womb. Yeah. There are studies of, autopsies of actually children and young adolescents that have atherosclerosis, which is that buildup of plaque inside the blood vessels. So, and now we're seeing childhood obesity is skyrocketing, type 2 diabetes in childhood is skyrocketing. And there is so much talk around putting children on statins because we're seeing all of these risk factors younger and younger and younger. And hopefully people are starting to realize that it matters what you eat your entire life. I remember growing up and thinking it doesn't really matter until you're in your 20s or your 30s, but it matters now. It doesn't matter how old you are. You should be really conscious of what you're putting in your body from day one.
So on the opposite end, is it ever too late?
No, absolutely not. So we had mentioned Dr. Caldwell-Esselstyn earlier. Then there's Dr. Dean Ornish. They are two renowned physicians in the cardiology arena, and they treat their patients with a plant-based diet. So Dr. Esselstyn treats strictly with plant-based eating. Dr. Dean Ornish treats with plant-based eating as well as physical activity and also stress management and social support. And they have shown incredible results. They have taken patients that have really significant and progressive heart disease, like whether it is a history of multiple heart attacks or open heart surgery, or they're destined to have open heart surgery. Like, for example, they may have just gone to the doctor and they said, you are going to need, X, Y, and Z if you don't make any changes. And they see Dr. Ornish, they see Dr. Esselstyn, and they effectively have reversed, not all of them, but a lot of them have reversed heart disease. So that word reversal is not even used in traditional healthcare. I say that to my patients all the time, and they're like, what are you talking about? What is reversal of heart disease? So Drs. Dean Ornish and Caldwell-Esselstyn have seen plaques inside of the blood vessels of their patients actually shrink and get smaller, which means better blood flow to the heart, which means prevention of, future heart attacks and need for more procedures. And they've had really, really sick patients change their way of eating. And then decades later, they are thriving. And you just don't see that in traditional healthcare. There's no medications have ever been shown to do anything like that. The best you can hope for is a slowing of the progression of heart disease. And even the touted, heart healthy Mediterranean diet has never been shown to do anything like that either. So that's the way to go.
I think that people really do need to realize that once a patient, not necessarily always a patient, right? There is such thing as reversal. I mean, we saw it with Adam. I showed you Adam's artery photos, yes. Right? I showed you that last week, and a year after eating plant-based, and I'm sure it happened earlier on, but that's just when we had the second scan, and you can see the difference in blood flow throughout the arteries because it just, the highway was not congested with all of that plaque, right? So it's amazing. My dad actually, my dad was plant-based for a while, and I wish he would have stuck with it, but we saw amazing improvements with his diabetes. We saw amazing improvements with his heart as well. He's actually not even, I work with him in a couple of different ways. Like we use the redox with him, and he was plant-based, and we try to reduce his meat intake as much as possible, but he's actually not a heart patient anymore. With the Heart Institute, they've kind of let him go and said, if you need us, we're here, but you don't need to come back for appointments anymore. So there's so much you can do. And we will also link to the 2 episodes that we did with Dr. Dean Ornish in the show notes at planttrainers.com as well.
What is it about the food, or what is the specific kinds of food that people should be eating? And is it important for them to be 100% plant-based, or for someone who's listening that might not be there yet, is it even worth doing it a little bit rather than all the way?
Yes, every approach is helpful. And I can't stress that enough, because we need to reach as many people as we can. I've met many people that change their diet overnight and dramatically and have had dramatic results. But studies are really clear that any step you take towards a plant-based diet can improve your heart health. So whatever you're willing and able to do, you should just start doing it right away. Because 1, you should just be, rest assured you will see improvements in your health. And 2, once you start trying just a handful of things and you start taking baby steps, you start to gain some confidence in knowing that you can make some changes. And maybe then your taste buds start to shift. You can experience neuroplasticity, where you start to enjoy the taste of actual food underneath all that fat and all that salt. And you may enjoy the taste of veggies more than you ever have. And maybe you'll lose the taste for meat. Dr. Ornish, his program is actually centered on a predominantly plant-based diet. It actually does allow a little bit of wiggle room for like low-fat yogurt, and maybe, I believe, egg whites is part of his program as well. So, that's not like me giving you permission to eat those things, but if that makes it more realistic for you to make those changes, then by all means. So again, just bottom line is every step you take towards a plant-based diet can improve your heart health, and then also give you that confidence as well.
So for people who are heading down the direction of needing statins or other heart medications, I just want to kind of go back a little bit when we were talking about thinking about putting children on statins and like a lifetime. What are the risk factors that come along with those medications, just to kind of get a reality check of, giving up your McDonald's burger versus, not taking a statin? What are we talking about here?
Right. Yeah, that's a great question, because certainly every medication has side effects. And, certainly some are not a huge deal. Sometimes people have muscle pain or discomfort with statins, but some people get very significant, severe muscle pain to a point where you're hospitalized. You can get a condition called rhabdomyolysis, which is a very dangerous condition. It's rare, but it can happen as a result of statins. And then also, we have to be realistic about the benefits of statins. They are overinflated, if we're going to be completely honest. And if you're comparing statins to Dr. Esselstyn's program, for example, diet can possibly be 20 times more effective in lowering not just cholesterol, but your risk of heart disease in general than heart medications.
But the heart medications are suppressing it, right? Like everything's still there. It's just allowing the body to try to still function properly. So you're not actually eliminating the problem, where with a plant-based diet, your chances of eliminating the problem, or at least significantly reducing it, is that much better, between blood flow and hardening of the arteries and just allowing the body to do what it's meant to do and clean itself out and not adding to the mess every day. Having said what you just said, I just want to put it out there. Don't go flush your statins down the toilet. Don't go stop using them now. Start to change your lifestyle, start to add more vegetables, slowly take out the animal products, or go cold tofu like Adam did, but let your doctors see what's happening in your body and let your doctors be the one to take you off your medications. Don't just go throwing them down the toilet, please.
Yes. Thank you, Shoshana. You're taking the words out of my mouth. Yeah, definitely. If you're going to make changes, especially the bigger the changes you are ready and willing to take, the more important it is to talk to your doctor. So please do not stop taking any of your medications on your own. You're not a doctor. Maybe you are, but definitely
maybe you are.
Definitely do that under the guidance of your doctor, and hopefully they are supportive and following you very closely so that they can kind of titrate them based on how your body is responding to how you're, changing the way you're eating.
So that's a good question. What are people going to start looking for to know if they need to go into their doctor sooner than they're supposed to because maybe now they're taking too much medication? So what are we looking for there?
Yeah, great question. So first of all, I would say talk to your doctor first. Don't even make changes, and especially for those on blood pressure medication and diabetes medication. Especially if you're on insulin, that's the most important scenario in which you should talk to your doctor. But yes, definitely start with talking to them first so that you can have a plan before you even start to make those dietary changes, especially in the context of high blood pressure and high blood sugars. You run the risk of getting those numbers down too low, which can be dangerous in both scenarios. So it's kind of a, in a way, a good problem. When you eat a plant-based diet, you can see a really significant drop in these numbers. I love to talk about this one study done by Dr. John McDougall, who put about, I believe, 1,600 people with high blood pressure on a plant-based diet for just 7 days. And they saw on average a reduction in systolic blood pressure, that top number, by 18 points and bottom number by 11 points. And in just 1 week, 86% of those patients on blood pressure medication either reduced their dose or got off their blood pressure medication altogether. So that is how quickly and how dramatically you can drop your blood pressure. And the same can happen with your blood sugars too. So if you're changing your diet dramatically and you're also taking those medications, you'll experience an additive effect. So one, they're both trying to simultaneously bring them down too low. So you have to make sure you talk to your doctor and, see if they want you to cut back your medication a little bit right away, or call them if you see certain numbers. And then of course, monitor yourself. So if you have one of those conditions, you should hopefully have a blood pressure monitor at home. You should have a glucometer or a blood sugar meter at home and check those numbers frequently so you know where you're running. You can see exactly how your body is responding to the new foods that you're eating. And then finally, pay attention to how you feel. So if you don't feel right, check your blood pressure or your blood sugars. If you're sweatier than normal, if you're feeling lightheaded or dizzy, if you are experiencing confusion or clammy hands, that could be a sign that numbers are running a little bit too low.
And what about exercise? So I know it's not spring now, but I know spring has I think what I read years ago, I don't know if it still is, but spring has an increase of cardiac events because people feel good, the days are longer, the weather's nicer, they get out there and they start exercising. So if you start, eating a little bit better and saying, oh, I got this, life is great, I'm going to go out for a 5K run, that can be hard on the body. So what do you recommend to people who are or cardiac patients in terms of exercise if it's not something that they're used to?
Hang on. I actually think that it's winter that's the issue, because a lot of people, especially in the northern areas where there's snow, they get outside and they think, oh, they feel good, and they start shoveling. And shoveling is shoveling the snow can be very taxing on the body and you don't realize it. So I know there's more incidents of heart attacks specifically because people are shoveling their snow.
Right. Yeah. Depending on the time of year, there probably are certain spikes in heart attacks for different reasons. The spring one I hadn't heard of, but around the winter time, for sure, shoveling snow is a very dangerous situation for a heart patient. If you experience a heart attack, nowadays we want you to get back to your previous level of activity, and probably much more so. But that's one thing that we say, just take off the list. Do not shovel anymore. But yes, and then in general, just exerting yourself in general out in the cold can be a little bit hard on the heart because your blood vessels are constricting in some areas and dilating in others, and can kind of limit blood flow to the heart. So you do have to be cautious in that way. And then of course, there are always the holidays too. So heart attacks spike around Thanksgiving and Christmas and New Year's. So you'll see that change also. But yes, otherwise, just like the precautions you would take when you're changing your diet, when it comes to exercise, again, talk to your doctor before you start an exercise program. If you have any of the diagnoses that I mentioned earlier, you can talk to them about cardiac rehab and get monitored, on a heart monitor and cardiac rehab before you start doing any exercise on your own. But otherwise, you start slow, you can rest as frequently as you need to, and just listen to your body. There is no amount of exercise or physical activity that is too little. And I just like to emphasize that, because also starting an exercise can be intimidating, especially if you have heart disease. So it's okay to, start out with a very slow walk, even if it's 5 minutes. And then our bodies are amazing. I've seen 90-year-old bodies adapt to exercise very, very quickly. So start out slow, start out just 5-10 minutes and gradually build. You'll notice that your body is saying, oh, this is starting to get easier. You might notice that after a week, in which case you can add a little bit more time, maybe pick up the pace a little bit faster, and just build from there.
I've had clients where we've started just standing, right? Staying
Yes.
standing for 3 minutes, walking to the bedroom and back, a minute walk, a 35-second walk with intention. There's nothing to be ashamed of. There's everything to be proud of that you're making those strides. No pun intended.
Yes, it's a good one though. I saw a study actually just this morning that standing can improve insulin sensitivity, which can improve blood sugars, which can improve heart health. So
look at you studying on a Saturday morning.
I know. I need to get a life.
Colleen, before we close out, I want to ask this question because I know we probably have a bunch of teenagers listening to this episode. And when it comes to nutrition, they are typically thinking that they're invincible and they could eat whatever they want. They're still young. Their body's still going to change and adapt. But as we know, and we talked about earlier, autopsies have shown that heart disease has started in children as young as 10 years old. And it's never too early, never too late to get started. But what steps can these teens start taking right now to help nutritionally improve their heart?
They can do, this will apply to anyone, but absolutely that you're right. That age group thinks they're invisible. I did, you did. I would say really just being open-minded and experimenting. So when it comes to plant-based nutrition, there are things that you and I are familiar with in terms of like ingredients and different cooking techniques and recipes that are now familiar and commonplace in our homes, but are really unfamiliar and may sound kind of weird to other people. And I encourage them to just try new things. Like, for example, I love talking about nutritional yeast. It's such an incredible ingredient you can use to make a cheese sauce to really intensify the flavor of so many different dishes. Tastes like cheese, it replaces cheese, and it's extremely, extremely healthy. And they can do something like that in their own kitchen very simply, and take something that, they think is really boring and make it kind of extraordinary. And also, they may think, well, I don't want to eat tofu. I hear it's gross. And, I'm personally not even a huge tofu lover, but I love making ground, beef out of tofu, which is absolutely delicious. And I think teens who might be used to ground beef and other high saturated fat foods would absolutely love a swap like this, where you just, kind of ground it up, bake it with some coconut aminos and nutritional yeast and tomato paste. And trying different things like that can really replace things that they're used to without having to sacrifice really anything. It's just a matter of being open-minded to that. And then also, trying to step away from that peer pressure. I'm sure a lot of friends around them are eating lots of junk food and lots of processed food, but, stepping out of your comfort zone and trying new things, I think, they might actually, who knows, maybe that'll rub off on their friends as well.
I think as the younger generations are moving into teenage years, I think it's cool to be different right now.
Yes,
like maybe not for the teens that are like in their early 20s now, but we see it with our kids. So as they become teenagers, it's like, it only makes sense not to fit in. It's like you're fitting in when you don't fit in. When you have your, like my daughter's wearing t-shirts that are extra large men, and she just like tucks it in on the side and she loves it, and nobody else is wearing that, but I think that's why she loves it. Yeah, it's cool to be different. It's cool to be different. So be different with your carrot sticks and tofu and granola.
I think we need to give them some credit too, because I think they're becoming much more conscious, in terms of how we treat the earth and animals and stuff like that. So
different from when we grew up.
For sure.
I know. Yeah. Moving in a good direction.
Great. Colleen, this has been amazing. So if people want to reach out and connect with you, where would you like them to go?
You can find me. I would love to connect with any of you, all of you on Facebook or Instagram. You can find me at Wellness Within LLC. I'm also on wellnesswithinhealthcoach.com, where you can find a ton of great info on dramatically improving your heart health. If you're a little bit intimidated, I have a free 5-day challenge on there to help you just take baby steps towards eating a more plant predominant diet, as well as get you moving and work towards a little bit of stress management. And there's also information in there on a program. I have a 28-day program called Live Vibrantly, which, there's a baby coming, so it's not running right now, but many times throughout 2022, I'll have Live Vibrantly running, which is geared towards, again, dramatically improving heart health, whether you have diagnosed heart disease or you just have a number of risk factors. It's an extremely supportive program and environment, both online and live. So you can find more information on that at wellnesswithinhealthcoach.com as well.
Fantastic. We're going to link to all that in the show notes at planttrainers.com.
Yeah. Thank you so much. Thank you for your expertise. Thank you for sharing your wisdom. And we know our listeners will have learned a lot, and hopefully they'll share it with someone who needs to hear it. And I like the PPD, the plant predominant diet. It's a little bit less scary. So share it out, people.
Yeah, absolutely.
Thanks, Colleen. Thank you.
Shoshana, Adam, this has been a pleasure. Thank you so much.
Thank you all so much for listening to this edition of the Plant Trainers podcast. We want to make sure that you subscribe on iTunes, Google Play, iHeartRadio, Stitcher, or any other podcasting platform.
We really appreciate the feedback we receive from you. Every time we get a 5-star rating or review on iTunes from one of our fans, it really helps other people find us, just like you did.
Thanks so much to our patrons. To become a patron, visit us at patreon.com/planttrainers. Even supporting us with $1 really makes a difference in the quality of the show.
And don't forget to connect with us on Instagram and Twitter. Our handle is @PlantTrainers. Like Plant Trainers on Facebook, join our newsletter, and check out our website at planttrainers.com for awesome recipes, a list of our services, and of course, our latest podcast.
We encourage you to email your questions to info@planttrainers.com so that we can help you improve your quality of life through nutrition and fitness.
So we hope we've inspired you today. Join us again next time and have a healthy day. Or is that too corny?
It's a little cheesy.